So warm welcome everyone to our 10th experience sharing session. Yes, if we are here, it's for the very first exercise of the full learning cycle. That's exercise on situation analysis and under the umbrella of the Movement for Immunization Agenda 2030. As always, I am here with Dr. François Gasse, and we are already in the third week of our exercise on situation analysis. And this week, our focus is on on completing 3 peer reviews for our colleagues' situation analysis on peer grade. So if you have completed peer review, you have the opportunity during this session to share your experience. And remember, peer review is very important because you have to, your peers depend on you to complete the exercise just as you depend on them. So you're supposed to give constructive, clear comments that will enable them to improve upon their work. But for you to do so, you need to take time to read, to go through their situation analysis, make sure you understand it, and then fetch from the wealth of experience that you have as far as immunization is concerned, and obviously from the guidance of the rubric to give them feedback that will enable them to complete, to improve their situation analysis, and that will be next week. So, but this week, our focus before Friday, that's in about 48 hours time, Friday, 11:59 p.m. Geneva time, you're supposed to, it's not 40, it's 24 hours. You're supposed to complete the 3 peer reviews using also the rubric. That's the guiding document that is prepared to guide you on the feedback you'll give to them. And that said, I'd like to invite you right now to raise your hand if you have completed at least 1 peer review and you want to share that with us during this session. I'm inviting you to raise your hand. But I see there is one person whose hand is raised, Ome Mediatrix, that has turned on the video but has no sound, so it's not able to hear me. So I'm putting, if someone can leave a message for Ome in the chat to look at the screen and follow the 2 steps to turn on their audio. That's step 1, to click on join audio, and step 2, to call using internet audio. If Ome, you can do that, you'll be able to hear us. So I'd like to turn now to Dr. François Gasse to tell us in essence, what should we have in mind while we set out to do a peer review of situation analysis. 3 questions that we need to ask ourselves when we're doing peer review of a situation analysis. Over to you, François. François, I'm asking you to unmute.
Hello to everyone present today. I think the peer review, as Charlotte mentioned, will be essential to do a better work when you analyze, just for the person you review and for yourself. I'm sure you have experienced that reviewing the work of somebody else make you feel that your work, your analysis situation could be updated and better. I think one thing I would like to stress, which I have to stress, try to be focused on the title, because on the guidance, the title is maybe not present, but on the form it is present, and it should not be a generic title, but what you want to achieve could be, I want to increase coverage by 10 points, I want to reduce dropout by 50% point, and by X date, but make sure you suggest that you review the specific title and it is very specific and you see clearly what is the objective of the person writing about the challenge to achieve those objectives. That's an important point in your review, and maybe you've looked at it or not looked at it, but something that needs to be added. I would say then when there is a challenge, really the challenge is one of the specific challenge is important, and the specific challenge has to be very clear when you read it. It should be quantified. You need data to, if you want to increase coverage, you want to reach from 50 to 60% coverage, and that's very important. Now the question you answer is to try to identify what are the causes of your challenge, why you have this challenge, and it will be to try to get the main cause and the root cause of the main cause, digging on the cause you consider the most important, with whatever you need to dig, whatever data you review, or mini actions you can take to have more information and come to the root cause, the famous 4 whys, you know. Now, the next step, I would like to stress, when you review, make sure the person has filled all the parts which are mentioned in the rubric. Sometimes people will leave it blank, sometimes they will be unspecific, and follow really the challenge, the cause, and the results are really the result of your analysis of the cause that will help you to get specific action. And it should not be generic, should be so as specific as possible. So that's a general review. When you read the pair, you're here to help the pair to make the best possible situation analysis that will help him to resolve his main problem. Over to you, Charlotte. And I'm looking forward to see 1 or 2 pair review.
Thank you very much. Thank you very much, François. So I'm turning towards participants in the room. Please raise your hand if you want to share your peer review experience with us. That is, you need to, even if you're not able to share your screen, I'll be delighted to do that for you. To briefly summarize the author situation analysis, explain how you completed your peer review and how your feedback will help the author to improve, and also share what you are learning from peer review, from this peer review that will help you to improve your own work. So if there is no raised hand, I think I'm going to ask for a volunteer in the room. I don't know if Saeed Mirabansha, Saeed, are you able to share a peer review, one of the peer reviews that you have done today? Are you able to unmute yourself?
Thank you, Charlotte. I'm audible?
Yes, you are.
Okay, thank you. This is Syed Mehraban Shah from Afghanistan, technical officer with the WHO country office. I have went through 3 peer reviews, DACO situation analysis, and I provided my feedback. But due to busy schedules, maybe not that much, but I tried to highlight some of the points that which was missing in the situation analysis done by our authors from anywhere. I don't know, but they mentioned their country's name, so that is the location and everything. So,
okay. Saeed?
Yes.
Which particular submission will you want to focus on today for this experience sharing?
So
should I take
the second one?
Okay, submission 2.
The second one that according to the guidance of rubric and which was facilitated by Charlotte Mbuh and François and Reda and Ja and the other days, and I have went through this situation analysis done by a person from Ebony, Nigeria, and his main challenge was lack of health workforce. But actually, when I saw that the document, which is the current level of working for the author's cover note, so I found that there was no cover note mentioned by this author in his situation analysis, and also the title of this situation analysis is also missing. You are watching this now?
Yes.
Charlotte?
Yeah.
Yes, we can see.
Yes.
Mm-hmm.
Okay, the title and also the cover note is missing over here. If you see, there is no cover note based on his situation analysis, and I have put this if you on the right hand you go scroll down, you see there is no title of the situation analysis, no summary of the situation analysis. You have, oh sorry, that what happened to this. Okay, So you no summary of the situation analysis. You have to write summary of your situation analysis based on your work, since it is very important for decision maker to convince them, as they may not have enough time to go through your all situation analysis, and she will decide based on your summary of situation analysis. The challenge you should be like that lack of a health workforce for the immunization service delivery in your area of concern. Secondly, the question should be like how to convince the leadership and governance to deploy health workforce for immunization services in the country. So these were my feedback for this author whenever he is writing his summary or cover note. Going to the my situation analysis in the second part of this situation analysis, he just highlighted to 1, 2, 3, 4 lack of health officer, lack of motivation to the staffs, and vaccination non-sustainability, no outreach, no mobility standby bus. So if we go to this rubric, and you will find that it is only the challenge, or only the question is identified, and dear author, so my suggestion was for this author that dear author, you have to read articles in your country, survey reports regarding the health workforce, and identify the beneath factors in why the number of healthcare workers are less in your country. In addition to you do you think that the country is lacking political commitment for the immunization program, and there is no demand for vaccination at the community to raise the issue to authorities to deploy healthcare workers in your county to tackle the issue? And it should be based on the reports, and it should be there's a reference should be given over there, and also using this movement or the full learning cycles, so the idea engines, and you should go there, and you should see there is maybe somebody have already added an idea regarding this health workforce, lack of health workforce in the idea engines, and so you can take benefit of that as well. So going to the third part of this situation analysis, that the data source, he only highlighted this 20 to 30% auxiliary staffs, or 20 to 40% health officer. What are the source of the data? It is not identified that which data source is used, and which one is the most important for him to be highlighted over here in his situation analysis in that part of this. So as I mentioned that above, please go through the published and gray literature and identify the source of data, since you have not reflected on the data source in your work or situation analysis. And going to the part 4, key findings. So if there is limited situation analysis, or limited work is done on the situation analysis, so how he will come out with key findings from his situation analysis? So the answer to the questions are to employ more staffs that will ensure that this is a generic thing, so generic, and we need specific findings, and it should be based on the situation analysis which the author is doing, and then he will be able to identify key findings, and for the key findings he will do actions, to take actions, and to tackle the issue of lack of health workforce for the immunization service delivery in his county. The issue should be discussed with the government at higher and convince them to deploy health workers at the country level to provide immunization services, both through fixed and outreach sessions. Your kindly key findings are mostly depend on your situation analysis. So you have to go through survey documents and identify more contributing factors for immunization service delivery in your country. This was my feedback and suggestions for him. And if we go to the next step, so he only giving the opportunity, this action I will take is to mobilize workers, have seminar with them, and then go for outreach to teach the community the importance of vaccines. So that means he and his next step, he's talking about the already stock is available, and he will go there and he will mobilize them and he will motivate them to provide immunization services. But it is not matching with the title or challenge he is facing in his county. Based on your situation analysis, you will come up with gap opportunity for immunization service delivery in your county, but it depends on your situation analysis in proper manner. I would suggest to rewrite your situation analysis by identifying gaps in the immunization services or in particularly lack of health workers at the country level for the immunization program. Please go further. Scroll down, Charlotte. Even though he that is good that he write here that given the reference of 3 authors from the idea engines, but it is I don't know he highlight reference here, but in the situation analysis nothing is mentioned over there, and he not properly use these references and also the resources or the data sources which is available in his country for the lacking of healthcare worker in his country. So my suggestion was that you have to go through the idea engine and identify specific related health workforce ideas and then reference it over here. If you have time, please go through it once again. You may find this idea related to your situation analysis. So these were my suggestion to this author, and I hope that he will improve his situation analysis, and he will resubmit his situation analysis as a final version. Thank you, and over from my side.
Thank you very much, Saeed, for this thorough review, and I'm inviting peers in the room to give your comments. But one thing I want to ask you, Saeed, even before I turn towards peers to leave their comments in the chat or raise their hands if they want to speak, was there anything you learned from this, from peer reviewing, that will help you to improve upon your own situation analysis?
Yes, it gives me a lot of things, because when I'm doing the situation analysis for others, and I will expect from others to give such comments on my and feedback on my situation analysis. But this is the time is over now, and I'm just waiting for the colleagues or other authors, scholars, that they will provide feedback on my situation analysis. And something is going on in my mind that the situation analysis which I submitted, there is points to be considered before submitting that. So now the time has been passed. So now I'm waiting for colleagues to provide their comments and feedbacks on my situation analysis to further improve my situation analysis as a final version and submit it to the database.
Thank you very much, Saeed. Fam Daniel, I know you raised your hand. I'm sure you raised your hand because you wanted to share your experience of a peer review that you have done. But we are going to get to that because your hand is raised for that. But I would like to hear, what are your thoughts concerning, what comments can you give to Saeed concerning this peer review?
Thank you very much, Saeed. I was looking, let's get to the my situation, the second, yes, my situation part. And let's look at the comment that he gave. Okay, first of all, can we look at the grading first? Yeah, this place I have a little bit, we are looking at my situation page. And in the situation page, we need to see there clearly the challenge is stated, and also the question to answer is also stated, and why and how this answering this question will help the person handle the challenge. So straightforward by mentioning all these is good, but where is the challenge? So I have a problem with the grading to say only challenge or only the question is identified. Under my situation, nothing is, the challenge is not identified. The question is also not identified. It might be at the introductory part, but when we are looking at my situation, you need to be able to put it here. I remember Reda was saying that, oh, some of these things will repeat itself because somebody will go to my situation. What is the challenge you are handling? What is the question you want to answer? So I believe that, to me, the grading, we want to be fair and help the person. He has not stated the grading and the answer and how answering this question, it will help to tackle the challenge. So I will prefer him to grade him the first point. This is why we are helping our peers. It's not just for anything, just to help him to do a good work. So I believe he never stated those things here. So it should have been, there's no challenge or question identified. So you should give him the first grading, which is the 0, for him to really know.
Alternatively, from Daniel, could it not be that he has identified several challenges instead?
That this at this point he never stated that. Yeah. Thank you.
Okay. Thank you very much, from Daniel. And I just wanted to ask you.
Charlotte,
That could it not be considered that all? Are you able to hear me?
now, yes.
Sorry, I'm getting indications that my connectivity is unstable. So I was just saying thank you to Farm Daniel for that. And I wanted to find out from you if you wanted to, because the grading is good, but I think the most important part is actually the feedback. So how can the peer improve upon his situation, writing it down clearly and stating everything here down clearly
Yes.
at this point? All right. Okay, thank you. François, any questions for Syed?
I think Syed did a very nice reviews that will be helpful. I think he has put his finger on the right things. And I think he has, it's difficult to review just now, it's just by memory. But I endorse many of his comments, and then the pairs that review. I think we need to be very cautious in the title. If your challenge, what's your challenge? In fact, your overall challenge, is it, I'm not very 100% clear, but you want to increase coverage. And then your main challenge is that you say that you don't, he has said that he has not enough staff. But we have no data initially. So I have, maybe I have only one. I know a place where some health center have only one staff, preventive curative care. We can't expect him to run outreach. So I would like, the lack of is very generic and cannot be stated like that. It should be much more specific, measured. I have so many workforce, and in fact, to do a good generalization, I need so many. Now the question is, if you want workforce and you want, your objective is to convince the government to have more workforce, you need to explain clearly what you are missing and why it's affecting your coverage. Now, the question you answer is sort of why you have so many and what are the consequences of so few health workers. Of course, part one we discussed, it should be maybe the person will write it after having made a good situation analysis. But now I think when there was the findings, go down, but a lack is like lack of money is not specific. You need to be much more clear on the number of workforce you aim to receive. If this is your challenge, say I want to have 50% more workforce, in which category, you should put it up. Now, in terms of the key findings is you know, you need to really justify that you find out that your main problem is the lack of staff. You have listed somewhere in the situation analysis, a list, as it was mentioned by the last speaker. It's a list, but we don't know which one is. It's okay to have this list, but sometimes I say putting more health workers if there's no vaccine may not be useful. The vaccine, not sustainability. If there is no outreach, is it a question? Is it due to lack of health worker? Or is it due to the no mobility? That means there is no transport. If you have no outreach, maybe the impact is huge in your area because 60% of the population need to be reached by outreach. And you have enough staff at the fixed facility, but not for outreach. So you need really, the local situation you should advise him to document much more. Lack is too generic. Lack of motivation, you need to find if truly you have a lack of motivation and how did you figure out. So otherwise, the finding has to come from surveys, situation analysis in detail. People have a plan, but don't execute the plan. Now, is it a motivation because they have the money to do it? They have the transport to do it. So it should be much more specific with figures and justification. And we are asking here the cause of the problem. What are the cause of the lack of staff? If you want to sell to your government, you will need good rationale to sell it and very good figures saying we can't do outreach with the amount of staff we have, for example. But you need to document it far more. And maybe this represents the action to take to make a better situation analysis before you look at the action to secure more staff. Thank you. And thank you for your comments, Syed. They were very relevant.
Thank you very much, François, and thanks, Syed. And yeah, talking about relevance of comments, I'm just, I saw that Syed gave concrete example. It's like, okay, this is a kind of question. This is a kind of question. You could formulate your question in this way. You could put your challenge, rephrase your challenge in this way. That is what peer review is also about, that you can concrete example, direct the person towards resources that will help them, that will give them more information about the challenge, about the situation, or where to find the right information. So once again, thank you. There was a question in the chat from Manisha Danan. Before we move forward, we're like 3 minutes to the end. You said you have reached submission 1, but how to go to the other submission. So Manisha, I am sure that if you are on peer grade, you see here, you have received 1 or 0 on 3 if you have not yet completed any. And there will be automatically, when you log on to peer grade to start peer review, you will see submission 1 at the top. Submission 1 will be at the top. You have to review it, go through the submission, the work of the colleague, and then on the right-hand side, you first of all grade, you grade the colleague's work part by part, section by section, and you leave your comments. Once you have done that, you go right to the end. You have to submit. The green button here will ask you to submit feedback. If you don't submit feedback for submission 1, you will not be able to access submission 2 and 3 because submission 2 will be locked. It only opens after you have submitted feedback for submission 1. So Manisha, I hope that helps to you. And there is a clear guidance that Reda prepared, a tutorial that prepared, and also in the experience in the technical support sessions of yesterday, we also looked at that, how to submit a peer review on peer grade. I'm going to share the link to that in the chat, the link to the tutorial as well in the chat. So I hope that helps, Manisha, and you can unmute yourself to tell us exactly if you have had the answer to your concern. So we are 1 minute to the end of the session, but as you all know, we always ask you if you want us to have more experience sharing. And if you want us to have more experience sharing, you can stay on. If not, if you're busy, you have to handle other tasks and issues, you can go ahead and do so. while, okay, thank you. Thank you, Manisha, for assuring me that your concern is solved. So, François, we can take one last experience sharing.
Yes, please do.
All right. So I'm going to be inviting from Daniel. Your hand was raised earlier on. Please go ahead and unmute yourself while are you able to share your screen?
Yes, let me check. Let me open it. Let me just open right now. And
okay. All right. So I'm going to stop sharing mine so that you're able to share your own. Okay, thank you very much, Said, for sharing your experience, and have a great meeting. Okay, from Daniel, I see you're muted.
hello.
Yes, hi.
Charlotte, you can share the third submission for me. I'm trying, it is difficult here, so you can share the third submission for me, the third one.
All right, that's okay. Let me do so straight away. Okay, here you go. This is submission 3. The one Geneva saving practices, something like that. Okay.
Thank you very much. I think mine is also similar to what Said shared. So, but I just want us to see what we have been experiencing over here.
From Daniel, forgive me, but I'd like to find, is there among the 3 situation analysis that you reviewed, is there one that was really good, so that, you know, let's get some positive?
Okay, we can look at the first one, but there were some things here that were relevant, so that I wanted us to look at.
Okay, at the end, I think we can come back to that, but let's look at this. Yeah. Okay.
All right.
So it's inadequate COVID-19 vaccination among chronic care clinical patients. All right. Okay. Over to you.
Submission 1.
Mm-hmm.
So the first, we go straight to the first grading on the cover notes. So we look at the cover notes. The cover notes, my author did well by stating some important information there on the cover note, which is so clear. But I gave him summary requires major improvement. Looking at what he has stated, low COVID-19 vaccination, misinformation of the general public about the COVID-19, inadequate COVID vaccine, inadequate COVID vaccine at this. So I saw that there is some summary requires major improvement. Why? That is where I come to the note that apart from the first bulleted point that has some correlation, the rest of the information on the cover note do not reflect the key findings, because he was supposed to wait when he has finished everything, then out of it, based on the key findings and the next steps, he can write appropriate cover note. He just mentioned, because when you later go and look at the key findings and the next step, you see that it is only the low COVID-19 that has a correlation with what you wanted to say. The rest don't reflect the key findings and the next step. And also there is an error of the third point and the key findings, which should move to next steps and should also reflect in the cover note. So what was happening is that the key findings and the next steps didn't really feature here on the cover note, because that is where we just want to get a catchy and attractive information to your supervisor or any team or audience who want to look at your situation analysis. So you just take your time and finish before you come to the cover note and write. So that is the information I give. And I say low or under reporting, poor health seeking behaviors, and low community sensitization and mobilization should be part of the cover note. So I've been able to state what he wrote, but in a different area. I brought it here that this should have been part of the cover note that he wrote. So that is what I said about this one. Then I move on to. So then I move on to the next one, that is on my situation itself. So we can move to my situation. On my situation, when you look, he wrote a very good information, a lot of information on my situation. The author did very, very well. But what I realized is that on all the issues that he raised, he forgot to what? Bring the challenge and the question. Because all this while we are looking at, state the challenge, state the question clearly. He had a very good background on everything so far as the situation is concerned, but he wasn't able to state what his challenge. Because your challenge here on top, you say your challenge is your challenge that you say is a very low COVID-19 vaccination among recipients of care attending an integrated chronic clinic in Neno district. So I was expecting that he should have what? Stated it clearly, because it's part of your situation. State that clearly, then you come and state the question also there. So it didn't feature at all. Though he had a lot of information to support the situation, it didn't feature. So I said no challenge or question identified. But I went ahead to give him that your challenge stated in my challenge column should be written under my situation. Also, the question you want to answer by analyzing your situation should be written here. That's why do we have low COVID-19 vaccination status among recipients of care attending integrated chronic care? Should be here and end with question mark, because it's a question, but it didn't appear here under my situation. And so I was telling him he has already stated in the introductory part, but he should introductory part on the top of the cover note that he want to do, but there was no question mark, but it's a question. So it should have come with what? A question at the end. And also the why and how answering that question will help him to tackle the challenge, what was not stated. So because the answering that question will give an opportunity to generate evidence needed for advocacy and engage various stakeholders to look into the future and start thinking of developing vaccines and drugs in that sub-Sahara area, because that is where he belongs. So if he is able to state the question well, it could help. It could help them. And I said if you don't state it, it will not help, because it will not deal with the question you seek to answer. You already have your information, so kindly reorganize them appropriately. So the author has so much information, but it's a matter of reorganizing them, stating the challenge, stating the question, and stating why answering this question will help him to resolve it. And all the other information are relevant. What he stated are relevant. So I said, you already have your information. So kindly reorganize them appropriately. Then the next one is on the source of data. On the source of data, yes, at least 2 data sources identified, but not clear why they are the best ones to answer the question. So when we come to the source of data, he stated the 2 data, all right, that this data, he stated them, but at the end, when you look into the information, they are good, but it doesn't give a clear way that it will be the best ones to answer those questions. So the 2 data information are there. And this is what I said about it. The challenge you want to work on is a localized issue. And therefore, the first source of data is appropriate. Since it is a system, you have it at the district that collate all the district data into a composite one. So the first one is very good, that is the district data. So you have the district data is okay. But the second data source is not directly related to or specific to the district. So what you could do is that you can use the Nano district, I was suggesting you can use the Nano district quarterly, half-yearly, or annual performance report on COVID-19. And these 2 data sources can easily be compared and find out whether or not there are gaps, such related to data completeness, consistency, accuracy, reliability, and timeliness. So the first data source is cool, but you could go further and use another data source, of which I've given other data sources for which you could find information. So you have data at the local level, and these can enrich your work very well. Good work done, and still have more room for improvement. So he has the data. The only thing is to do a proper, take a proper data to compare with the one from the district health information system. Then we come to the key findings. With the key findings, in a summary, he gave COVID-19 vaccine coverage is low. The data is inadequate due to poor seeking behavior, hence some of the illness and death were not reported. Community sensitization need to be upskilled. Health workers need to be upskilled and this. Because, so I said the 2 findings outlined were not very specific and measurable because there were no statistics or percentages or numbers associated with them. Examples, COVID-19 vaccine is low in sub-Saharan low countries. What is the percentage? Is your finding. What is low is good, but what is the percentage? What is the statistics that somebody will know and say that, oh, it is really low? It is not clear here. And also, it is so general statement. You are dealing with a situation at Nano district, so you must give the exact coverage for that district, but not for a whole number of countries. We are saying sub-Saharan countries, but you are within the Nano district. So even if you state that, you should still come back to that district and give us a figure for that district. And the second findings can be separated into 2. And this is how I did it for him, that it can be low or underreporting, and you give statistics, poor health seeking behavior, and low community sensitization and mobilization, because there were too many of them into one center. So you can put them, divide them into about 3. And the third key finding should be moved to next step, because he's talking about action you want to take. Community sensitization needs to be upskilled and all those things. It shouldn't be at the key findings, but rather move to the next steps. So I told him that you should move that one to the next steps, and the rest should be separated to 3 different steps. So when he moves them to the next step, then he can then divide them, because community sensitization needs to be upskilled. Community health programs need to be upskilled and improving in data capturing, storage, and analysis. It should be separated into 3 different steps and moved to the next steps column. Kindly find out other specific findings to the question you seek to answer by using the root cause analysis of the 5 whys. Please, you did well and can improve upon. So that is what I gave so far as the key findings were concerned. Then I moved straight. I move straight to the next next steps. So with the next steps, I saw that he never wrote any next steps there at all. So I've identified some of the next steps for him. So I said he should move there. So no next steps were written under this page. However, with little patience and critical analysis, some actionable steps can be written based on the key findings listed. However, as I said during the review of the key findings, the 3rd point, which were 3 in 1, should be written under the next steps as 3 different steps to be taken. Kindly indicate other steps that can be actionable as you work more on your findings, as I have please indicated. Thank you for the work you have done so far. Then the last one was on the references. On the references, I say yes, sources require minor improvement. It's just minor improvement. You gave references which are good. However, because COVID-19 vaccines are new and the whole world is undertaking this vaccination, it will be very appropriate to seek more contributions from your colleagues, since your country and district, for that matter, is not the only one facing such challenge. There are more ideas or practices in the ideas engine shared by colleagues on this learning platform. So from all parts of the globe, with profound suggestions which would help you adequately. So search for additional ones. Please, you have done well and you can do more. So you just look for only 2 is good, but there are so many of us, of the colleagues on the ideas engine, that you could get so much ideas from and practices that are working in their area, of which if you search for more, you will. Because at a point, I did the same thing. I was getting more than 7 this thing. I was able to then put the 7 authors here with their references, and it really helped. So thank you very much, Charlotte.
Thank you so much, Fam Daniel, and thanks to, I'll just start with Yakub Akulo's comment in the chat that says, good review presentation, Fam Daniel, good review and recommendation offer. Please, your comments in the chat, or you raise your hand if you want to tell us what you think about this very thorough review from Fam Daniel, Chrissy Ekwam. François, any questions for Fam Daniel? What are your thoughts?
I haven't, you know, Charlotte, I'm very impressed by the review made by Fam. It's excellent because he's very clear on the point that he has some concern. He gives a sort of a very adequate scoring, and he always is very specific in his comment, and he always raises concrete suggestions to made to the pair to review the situation. So I think he has put the finger on what is expected from a peer review. It's like a model and should be used as a model. Bravo, Fam, and very impressive the way you do your review. And congratulations, and I'm sure it will help a lot. The pair was written for your review. That.
Thank you so much, François.
Thank you very much, François.
Yeah, and one other thing was the ability to actually encourage the pair that good work, thank you, this is what you have done, this is how you can do to improve. That way, remember, we said the golden rule for peer review is, give your comments in the way that you want to receive them yourself. This way, when the peer and the colleague reads this comment at the end, they are encouraged to do better because they see that the efforts that they made are really appreciated. So thanks again, Fam Daniel. And if there are no other comments or raised hand, I see we have gone way over time, but I believe that this is a very useful and constructive exercise that is helping us. And one thing, I see Taban Mirwa says it's a thorough review. The reviewer gave a very sufficient information. I have actually learned a lot from his presentation. Thank you, Daniel. And that's the whole essence of the exercise. But one thing I want to share with you, one thing you can still do, even if you have already finished the 3 peer reviews, after having listened to the experiences shared today, if you have learned one thing that can help you to improve upon the reviews you have already done, peer grade gives you the possibility to do so. So just give me a second, and if Daniel permits, I'm going to use his page again just to show you, to demonstrate to you that right now on peer grade, you can still revisit your comments that you have made and add more information. After listening to all the experiences that have been shared today, you can actually come, if you click into the space where you type your comment, you see that you can continue writing. And once you have finished, do not forget, for each section, if you add the improvements that you want to do on the review, because remember, the whole essence of the peer review is to help your peers, is to help your colleagues to improve upon their situation analysis. So if after listening to this experience sharing today, you think that there is some more information that you can add to your comments, to your feedback, go ahead and do so on peer grade. After doing so, you just need to come down to the end, to the bottom of the peer review and click on save feedback. Once you click on save feedback, as from Saturday morning, when the peer will access peer grade to look at your comments, they will be able to see everything that you have written. So this is just to tell you that before the deadline tomorrow, you have the opportunity, you still have the possibility to improve upon the peer reviews that you have already made on peer grade. And also, just to show you, some may ask me, but how do I see the peer reviews? So if you log into peer grade right now, when you've already finished the 3 peer reviews, you will see you have no upcoming tasks right now, but you need to go to Full Learning Cycle 1, your situation analysis, and you click on initial version. Once you do that, you go to review where the tick is. If you go to submission, you're going to see your work that you submitted instead. But you want to see the work, the submissions of others, the reviews that you have done. So you click on review. Once you click on review, you'll be able to see submission 3, and you can go to submission 1, submission 2, submission 3, and do all the improvements that you want to do in the peer reviews, and make sure at the end you save the feedback. And for those who are asking, how will I see where is the feedback that my peers have done? So as of next week, you will be able to react. React is where you go to see the comments that peers left for your situation analysis, and to see and to tell them if you found that the comments, the feedback is useful and helpful to you. So that is why we are calling it a reaction. You are reacting to that feedback. You're going to get more instructions on that in the coming days. So just as a reminder before we go, we have our technical support session tomorrow. But yesterday, we had very few people, basically very few people that had technical issues. So we ended up transforming our technical support session of yesterday into an experience sharing session. So, but tomorrow we have the technical support session. Is really the time to make good use that we can use to move ahead with the peer review. So if you're facing any challenges, make it a date with us tomorrow at 1:30 p.m. Geneva time for our technical support session. I'm just going to put the link for you in the chat. The registration link for the technical support, I just put it in the chat for you to register and join the session if you're having any technical issues. All right, so I'm going to turn towards François Gasse for the closing remarks, the key message for today's experience sharing session, and look forward to seeing you tomorrow for technical support. For those who are still doing peer review, please do not delay. You have just a little over 24 hours to complete them. Make sure that you complete the peer reviews and that you give useful and constructive feedback to peers. Over to you, François.
Merci, Charlotte. I think Farm has illustrated exactly the kind of peer review we need to improve the review by another, the analysis by another pair. I would like to stress as well that the title is very, in general, in the situation analysis, we found that the title is very often very weak. There is a misconception about the title, which should be your objective. And we need to be sure, look at if the challenge is properly justified with some specific data, measuring data, because your challenge is what you're going to measure over time with your corrective measures. So it's important to have a challenge. And as Pham has highlighted, you know, the finding of the situation analysis is looking first is positioning the challenge in front of many of the challenges you may have, and you choose one because you have good evidence data, information for different sources, and then you dig into the cause. And I think it's important to analyze the cause and not have a line listing of cause. Among those causes, choose one and tell with the data what you'll find, or you need to dig in additional data to get an information on the cause and the root cause of the problem. And I think being very constructive, very positive, and suggesting concrete way to improve the work of your pair is what the best things, reconforting him. It's a difficult exercise when you've never done it. There's a lot of concept in it, which the participants see for the first time. Some are more equipped than others to answer, but it's a difficult exercise, though you have to acknowledge that. And it's a learning process. So you are almost a good coach to make them, at the end of this exercise, know much more than they knew at the beginning of the exercise. And make sure there's nothing blank left in the highlight, the blanks, and suggest what should be in the blank, suggest the part of the grid criteria that will help you to fill the blank. Thank you, Charlotte. Thank you to everyone today. Always a good learning for me too. Bye-bye.
Bye. Thank you so much, François. I'm asking everyone to unmute because it's been a great session. So please go ahead and unmute yourself and put your hands together for you, even if you're learning part of your computer screen, for all the work that you're doing with peer review, but especially for our presenters of today, Syed Miraban Shah, that is not here, and Pham Daniel, everyone that has also left comments in the chat. Congratulations to you, and look forward to seeing you tomorrow for the technical support session. I'm sure it's going to be useful and helpful and help us all to improve upon our peer reviews. So wish you a nice day, and bye for now.
Bye-bye to all for now.
Bye-bye. Bye. Bye.
Yeah.
Thank you.
Hello?
Say bye-bye na makabaya.
Hello?